Good afternoon, everyone. We are the group 4 and we will going to report our topic. Hypertrophic pyloric stenosis or HPS is a blockage of the passage out of the stomach due to thickening of hypertrophy of the muscle at the junction between the stomach and the intestines. The thickened muscles create a partial blockage or the obstruction that interferes with the passage of stomach contents into the small intestine. Hypertrophic pyloric stenosis or HPS causes a functional gastric outlet obstruction as a result of hypertrophy and hyperplasia of the muscular layers of the pylorus. In infants, hypertrophic pyloric stenosis is the most common cause of gastric outlet obstruction and the most common surgical cause of vomiting. The medical management. The treatment of a child with pyloric stenosis includes pre-hospital care, correction of dehydration, and diet. In pre-hospital care, as with all pediatric resuscitations, pre-hospital care in patients with pyloric stenosis should be consistent with pediatric advanced life support or PALS. Recommendations for infants who are dehydrated or in shock. In correction of dehydration, if significant dehydration has occurred, immediate treatment requires correction of fluid loss, electrolytes, and acid-base imbalance, starting with an initial fluid bolus 20 ml per kilogram of isotonic crystalloid. Diet. Feeding can be initiated from 4 to 8 hours after recovery from anesthesia. Although earlier feeding has been studied, infants who are fed earlier than 4 hours do not have a worse total clinical outcome. However, they do vomit more frequently and more severely, leading to significant discomfort for the patient and anxiety for the parents. We have this pyloromyotomy. It is a surgical procedure called a pyloromyotomy, also known as a Frederick-Ramstedt operation, is the treatment of choice. Nursing assessment. Assessment in a child with pyloric stenosis include assess the child history of vomiting, assess for the child's elimination, and physical examination. Nursing interventions are maintain adequate nutrition and fluid intake. It is to prevent dehydration, provide mouth care, promote skin integrity, promote family coping. We also have this condition called cleft lip and cleft palate. These are birth defects that occur when a baby's lip or mouth do not form properly during pregnancy. Together, these birth defects commonly are called orofacial clefts.
Causes and risk factor. The cause of orofacial cleft among most infants are unknown. Some children have a cleft lip or cleft palate because of changes in their genes. Cleft lip and cleft palate are thought to be caused by a combination of genes and other factors, such as things the mother comes in contact with in her environment, or what the mother eats or drink, or certain medications she uses during pregnancy. What is cleft lip? The lip formed between the 4th and 7th weeks of pregnancy happens if the tissue that makes up the lip does not join completely before birth. This result is an opening in the upper lip, small or large slit. What is cleft palate? The roof of the mouth or the palate is formed between the 6th and 9th weeks of pregnancy. It happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. Management and treatment. Surgery to repair a cleft lip usually occurs in the first few months of life and is recommended within the first 12 months of life. Surgery to repair cleft palate is recommended within the first 18th month of life or earlier if possible. Nursing care planning and goals. Maintaining adequate nutrition, increasing family coping, reducing the parents' anxiety and guilt regarding the newborn's physical defects, and preparing parents for future repair of the cleft lip and palate.
Esophageal atresia. It refers to a congenitally interrupted esophagus. It has one or more fistulae may be present between the malformed esophagus and the trachea. The exact cause of esophageal atresia is still unknown, but it appears to have some genetic components. Up to half of all the babies born with esophageal atresia have one or more other birth defects, such as trisomy 13, 18, or 21. Other digestive tract problems, such as intestinal atresia or imperforate anus. There are 6 types of esophageal atresia. We have the type A, or the esophageal atresia without fistula, or so-called pure esophageal atresia, has a 10%. And type B, esophageal atresia with proximal TEF, is less than 1%. Type C, esophageal atresia with distal TEF, has 85%. Type D, esophageal atresia with proximal and distal TEFs, has less than 1%. Type E, TEF without esophageal atresia or so-called H-type fistula, has a 4%. And type F, congenital esophageal stenosis, has less than 1% and not discussed in this article. So, as we can see in the picture, we have here the normal anatomy of the trachea, esophagus, and stomach. There is also the atresia with distal fistula, where the fistula are being connected in trachea, and the atresia with double fistula, where the atresia and fistula are connected in trachea, and atresia with proximal fistula, where the fistula are connected in trachea. So, for the nursing assessment, we have to know the history of the patient and conduct a physical examination. Nursing intervention, we have to ensure safe swallowing of the patient, prevent aspiration, and reduce anxiety of the patient.
Entussusception is a process in which a segment of intestine invaginates or telescopes into the adjoining intestinal lumen, causing bowel obstruction. It occurs most commonly at the juncture of the ileum and the colon, although it can appear elsewhere in the intestinal tract. The invagination is from above downward, the upper portion slipping over the lower. Intussusception is a serious condition in which part of the intestine slides into an adjacent part of the intestine. This telescoping action often blocks food or fluid from passing through. Intussusception also cuts off blood supply to the part of the intestine that's affected. What are the causes of intussusception? The causes of intussusceptions are hyperperistalsis and digestive system activities. Hyperperistalsis is a condition marked by excessive rapidly of the passage of food through the stomach and intestine. Nursing assessment history. Nursing intervention, intravenous fluids, decompression, monitor I&O, education. Hirschsprung disease or aganglionic megacolon, congenital aganglionic megacolon, also called Hirschsprung disease, is characterized by persistent constipation, resulting from partial or complete intestinal obstruction of mechanical origin, resulting from the absence of enteric neuron within the mesenteric and submucosal plexus of the rectum and or colon. It's not clear what causes Hirschsprung disease. It sometimes occurs in families and might in some cases be associated with a genetic mutation. Hirschsprung disease occurs when nerve cells in the colon don't form completely. Nerves in the colon control the muscle contraction that move food through the bowels. Nursing interventions promote skin integrity, promote comfort, maintain fluid balance, provide oral and nasal care, provide family teaching. Anorectal malformation include a wide spectrum of defects in the development of the lowest portion of the intestinal and urogenital tracts. When a malformation of the anus is present, the muscle and nerves associated with the anus often have similar degree of malformation. The position and nature of this malformation made repair difficult for early surgeons. The affected organs are located deep in the pelvis and are not well visualized through abdominal incision. Anorectal malformations are birth defect or problems that happen as an unborn baby is developing during pregnancy. With this defect, the anus and the rectum don't develop properly. They are the lower part of the digestive tract. Ano means anus. This is the opening at the end of the large intestine. Causes are VACTERL association, a syndrome in which there are vertebral, anal, cardiac, tracheal, esophageal, renal, and limb abnormalities, digestive system abnormalities, urinary tract abnormalities, abnormalities in the spine. Treatment are narrow anal passage, surgery may not be needed. Anal membrane surgery is done to remove the membrane. Lack of rectal and anal connection with or without a fistula. A series of surgeries is done to repair the problem. Nursing care planning and goals. Maintaining adequate hydration with moist mucous membranes, skin turgor, and capillary refill good. Maintaining stable vital signs. Achieving adequate output of urine. Achieving dry and damage-free skin around the colostomy. Absence of infection. Nursing interventions avoid infection, protect skin integrity, restore balanced fluid volume. Gastroesophageal reflux is excessive reflux of hydrochloric acid into the esophagus. Risk factor: incompetent lower esophageal sphincter, pyloric stenosis, or a motility disorder. Gastroesophageal reflux disease is a digestive disorder that occurs when acidic stomach juices or food and fluids back up from the stomach into the esophagus. Gastroesophageal reflux disease is caused by frequent acid reflux. When you swallow, a circular band of muscle around the bottom of your esophagus, lower esophageal sphincter, relaxes to allow food and liquid to flow into your stomach. Then the sphincter closes again. Nursing management. Teach the client to avoid factors that increase lower esophageal irritation. Eat a low-fat, high-fiber diet, Avoid irritants such as spicy or acidic food, alcohol, caffeine, and tobacco because they increase gastric acid production. Avoid food or drink 2 hours before bedtime or lying down after eating. Elevate the head of the bed on 6 to 8 bucks. Lose weight if necessary. Constipation. It occurs when bowel movements become less frequent than normal. It is accompanied by a difficult or incomplete passage of stool. It happens most often due to changes in diet or routine or due to inadequate intake of fiber. Causes of constipation: limited fluid intake, low fiber diet, lack of activity, sedentary lifestyle, medication use, laxative overuse, tumor, stress, depression, lack of privacy, fear of pain with defecation, ignoring urge to defecate, neurogenic disorder. Signs and symptoms of constipation: passage of dry hard stool, passage of liquid fecal seepage, infrequent passage of stool, frequent but non-productive desire to defecate, straining at stool, nausea and vomiting, anorexia, abdominal distension, dull headache, pain with defecation. Nursing interventions: encourage the patient to take in fluid 2,000 to 3,000 ml per day, if not contraindicated medically. Assist patient to take at least 20 grams of dietary fiber. Example, raw fruits, fresh vegetables, whole grain per day. Urge patient for some physical activities and exercise. Consider isometric abdominal and gluteal exercise. Encourage a regular period of elimination. Digitally eliminate and fecal impunction.
Appendicitis. Appendicitis is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. The appendix is located in the lower right abdomen. It is a narrow tube about 4 inches long and it sticks out from the large intestine. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves. As inflammation worsens, appendicitis pain typically increases and eventually becomes severe. Although anyone can develop appendicitis, most often it occurs in people between the age of 10 and 30. The symptoms are sudden pain on the right side of abdomen, nausea and vomiting, loss of appetite, fever, constipation or diarrhea, abdominal bloating. Causes: a blockage in the lining of the appendix that result in infection is the likely cause of appendicitis. The bacteria multiply rapidly, causing the appendix to become inflamed, swollen, and filled with pus. If not treated promptly, the appendix can rupture. Appendicitis occur when there is blockage in the appendix. This blockage may occur from a feces buildup or from other body parts. The bacteria, worms, parts, and viruses can also cause appendicitis. To treat appendicitis, doctors surgically remove the appendix. Doctors will be prescribed antibiotic before surgery and after surgery to reduce pain and prevent any other ones. Nursing intervention for the patient with appendicitis. The nurse prepares the patient for surgery. They prepare IV infusion. An IV infusion is made to replace fluid loss and promote adequate renal functioning. Antibiotic therapy is given to patient to prevent infection. Positioning. After the surgery, the nurse places the patient on a high Fowler's position to reduce the tension on the incision and abdominal organs, thereby reducing pain. Oral fluids. When tolerated, oral fluids could be administered.
Inflammatory bowel disease is an umbrella term used to describe disorders that involves chronic inflammation of your digestive tract. Types of IBD include ulcerative colitis. This condition involves inflammation of and sores or ulcer along the superficial lining of your large intestine, colon, and rectum. Signs and symptoms: diarrhea, fatigue, abdominal pain and cramping, blood in your stool, reduced appetite, unintended weight loss. Causes: the exact cause of inflammatory bowel disease remains unknown. Previously, diet and stress were suspected, but now doctors know that these factors may aggravate but aren't the cause of IBD. One possible cause is an immune system malfunction. When your immune system tries to fight off an invading virus or bacterium, an abnormal immune response causes the immune system to attack the cells in the digestive tract too. Heredity also seems to play a role in that. IBD is more common in people who have family members with the disease. However, most people with IBD don't have this family history. Risk factors. Age. Most people who develop IBD are diagnosed before they're 30 years old, but some don't develop this disease until their 50s and 60s. Race or ethnicity. Although whites have the highest risk of this disease, it can occur in any race. Family history. You are at higher risk if you have a close relative such as parents, siblings, or child with the disease. Cigarette smoking. Cigarette smoking is the most important controllable risk factor for developing this disease. Non-steroidal anti-inflammatory medications. These include ibuprofen, naproxen sodium, diclofenac sodium, and others. This medication may increase the risk of developing IBD or worsen the disease in people who have IBD. Treatment for IBD. There is currently no cure for IBD. The goal for treatment will be to reduce the symptoms, achieve and maintain remission, and prevent complications. The most common treatments for IBD are medications and surgery. Medications: anti-inflammatory drugs, corticosteroids, immune suppressors, and biologic therapies. Nursing interventions: ascertain onset and pattern of diarrhea. Observe and record stool frequency, characteristics, amount, and precipitating factors. Observe for presence of associated factors such as fever, chills, abdominal pain, cramping, bloody stool, emotional upset, physical exertion, and so forth. Promote bed rest, provide bedside commode, remove stool promptly, provide room deodorizer, identify and restrict foods and fluid that precipitate diarrhea, such as vegetables and fruit, whole grains, cereal, condiments, carbonated drinks, and milk products. Restart oral fluid intake gradually. Offer clear liquids hourly. Avoid cold fluids. Provide opportunity to vent frustration related to disease process. Observe for fever, tachycardia, lethargy, leukocytosis, decreased serum protein, anxiety, and prostration.
Peptic ulcer. Peptic ulcer are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. The most common symptom of the peptic ulcer is stomach pain. The symptoms are fatigue, heartburn, loss of appetite, vomiting, nausea, bloating, burping, weight loss, dull pain. Causes are Helicobacter pylori, bacterial infection, non-steroidal anti-inflammatory drugs, Zollinger-Ellison, alcoholic beverage, hypercalcemia, family history, excess stress, low levels of melatonin. Treatment for peptic ulcer depend on the cause. Usually, treatment will involve killing the Helicobacter pylori bacterium if present, eliminating or reducing use of NSAIDs if possible, and helping your ulcer to heal with medication.
Preoperative interventions. Maintain NPO status. Administer fluid intravenously to prevent dehydration. Monitor for changes in level of pain. Monitor for sign of rupture appendix and peritonitis. Position right side lying or low to semifolder position to promote comfort. Monitor bowel sound. Apply ice packs to abdomen every hour for 20 to 30 minutes as prescribed. Administer antibiotics as prescribed. Avoid application of heat in the abdomen. Avoid laxative or enema. Post-operative interventions. Monitor temperature for sign of infection. Assess incision for sign of infections such as redness, swelling, and pain. Maintain NPO status until bowel function has returned. Advance diet gradually or as tolerated or as prescribed when bowel sound return. If rupture of appendix occurred, expect a Penrose drain to be inserted or the incision may be left to heal inside out. Expect that drainage from Penrose drain may profuse for the first 2 hours. Necrotizing enterocolitis is an inflammation in the intestines and usually occurs in premature babies. The damage that NEC causes to the intestinal tissues can cause a hole in the intestines that allows bacteria leak. What causes necrotizing enterocolitis? The cause of NEC is unclear. It may be a result of too little oxygen or blood flow reaching the intestines, causing them to weaken. When in this weakened state, bacteria from food that enters the intestines can cause damage or death to the tissue that lead to severe infection. Contrary to popular belief, breast milk does not cause or prevent NEC. Prematurity is the most common cause. What are the symptoms of necrotizing enterocolitis? Symptoms of NEC usually develop in the first 2 weeks and may include the following: bloating or swelling in the tummy, poor tolerance to feedings, frequent vomiting, possibly green in color, bloody stool, bowel movements, redness or abnormal color to the tummy, lethargy, lack of energy, fever, and apnea. Pauses in breathing. Treatment of NEC is dependent on many things including the baby's age and overall health. His/her tolerance to specific medications, and the extent of the disease. Nursing interventions. Stop all regular feedings. The baby receive nutrients through an intravenous catheter. Placement of nasogastric tube extending from the nose into the stomach. The tube suction air and fluids from the baby's stomach and intestine, relieving swelling and comfort. Celiac disease is an immune disease in which people can't eat gluten because it will damage their small intestine. If you have celiac disease and eat foods with gluten, your immune systems respond by damaging the small intestine. Gluten is a protein found in wheat, rye, and barley. Symptoms of celiac disease: unexplained weight loss, stomach and muscle cramps, numbness and tingling in legs, tooth enamel loss, joint pain, weak bones, infertility, and chronic diarrhea or constipation. Causes of celiac disease: your genes combined with eating foods with gluten and other factors can contribute to celiac disease, but the precise cause isn't known. Infant feeding practices, gastrointestinal infection, and gut bacteria might contribute as well. Sometimes celiac disease become active after surgery, pregnancy, childbirth, viral infection, or severe emotional stress. The only treatment for celiac disease is to follow a gluten-free diet, that is, to avoid all food that contain gluten. For most people, following this diet will stop symptoms, heal existing intestinal damage, and prevent further damage. Improvements begin within weeks of starting the diet. Nursing interventions: provide parenteral nutrition as prescribed, provide meticulous skin care after each loose stool, and apply lubricant to prevent skin breakdown. Encourage small, frequent meal, but do not force eating if the child has anorexia. So what is anorexia? Anorexia is an eating disorder characterized by an abnormal low body weight, an intense fear of gaining weight, and a distorted perception of weight. Lactose intolerance is a common digestive problem where the body is unable to digest lactose, a type of sugar mainly found in milk and dairy products. The symptoms of lactose intolerance are farting, diarrhea, a bloated stomach, stomach cramps and pains, stomach rumbling, and feeling sick. What causes lactose intolerance? The body digests lactose using a substance called lactase. This breaks down lactose into two sugar called glucose and galactose, which can be easily absorbed into the bloodstream. People with lactose intolerance do not produce enough lactase, so lactose stays in the digestive system where it fermented by bacteria. How can we treat lactose intolerance? There is no cure for lactose intolerance, but cutting down on foods and drinks containing lactose usually helps to control the symptoms. Lactose-free products include lactose-free cow's milk, soya milks, yogurts, and some cheese, rice, oats, almonds, hazelnut, coconut, quinoa, and potato milks. Your GP may include recommended calcium and vitamin D supplements. Nursing interventions: limit the amount of milk and milk products in your child's diet. Have your child eat or drink milk and milk products along with other food. For some children, combining a solid food like cereal with a dairy product like milk can reduce symptoms. Have your child eat small amount of milk products throughout the day instead of larger amounts all at once. Have your child eat or drink milk and milk products that have reduced lactose. Have your child eat or drink other foods instead of milk and milk product. Have your child try soy beverage and soy cheese. Use lactase products. These are dairy supplements that help your child digest lactose. Some children who are lactose intolerant can eat some kinds of yogurt without problems, especially yogurt with live cultures. Find other sources of calcium. These include calcium fortified orange juice, almonds, and dark green vegetables such as broccoli. If you are worried about your child getting enough nutrients, ask your doctors about giving your child supplements such as calcium and vitamin D.
Lead poisoning. Lead poisoning, an acute or chronic poisoning caused by the absorption of lead or any of its salts into the body. Lead poisoning is an environmental hazard that is capable of causing mental retardation, behavioral disturbance, and brain damage. Lead poisoning occur when lead builds up in the body, often over months or years. Even small amounts of lead can cause serious health problems. Children younger than 6 years are especially vulnerable to lead poisoning, which can severely affect mental and physical development at very high levels. Lead poisoning can be fatal. The symptoms are headaches, irritability, reduced sensation, aggressive behavior, difficulty sleeping, abdominal pain, poor appetite, constipation, anemia. The additional complication for children, lead is more harmful to children as it can affect developing nerves and brain, loss of developmental skills, behavior, attention problems, hearing loss, kidney damage, reduced IQ, slow body growth. Causes: lead is a metal that occurs naturally in the earth's crust, but human activity, mining, burning fossils, fuels, and manufacturing has caused it to become more widespread. Lead was also once used in paint and gasoline, and it's still used in batteries, solder, pipes, pottery, roofing materials, and some cosmetics.
Prevention. Simple measure can help protect you and your family from lead poisoning. Wash hands and toys. To help reduce hand-to-mouth transfer of contaminated dust or soil, wash your children's hands after outer play, before eating, and at bedtime. Wash their toys regularly. Clean dusty surface. Clean your floors with a wet mop and wipe furniture, window wheels, and other dusty surface with a damp cloth. Remove shoes before entering the house. This will help keep lead-based soil outside. Run cold water. If you have older plumbing containing lead pipes or fittings, run your cold water for at least a minute before using. Don't use hot tap water to make baby's formula or for cooking. Prevent children from playing on soil. Provide them with a sandbox that's covered with when not in use. Plant grass or cover base soil with mulch. Eat a healthy diet. Keep your home well maintained. Regular meals and good nutrition might help lower lead absorption. Children especially need enough calcium, vitamin C, and iron in their diets to help them keep lead from being absorbed. If your home has lead-based paint, check regularly for peeling paint and fix problem promptly. Try not to sand, which generate dusty particles that contain lead. Nursing interventions reduce lead exposure. Children with symptomatic lead poisoning, with or without encephalopathy, must be treated only at a pediatric center that has an intensive care unit. They should be managed by a multidisciplinary team that includes, as needed, critical care, toxicology, neurology, and neurosurgery. The child's neurological status and fluid balance must be carefully monitored. Medication administration. Administer edetate calcium disodium or EDTA as ordered intravenously because intramuscular administration is painful. Monitor for side effect. All the chelating drugs have toxic side effects, and children being treated must be carefully monitored with frequent urinalysis, blood cell counts, and renal function. Education. Educate the family about lead poisoning prevention and nutrition. Remove lead containing materials. Throw out old painted toys if you do not know whether the paint contains lead. Avoid canned goods from foreign countries, and the walls must be covered with paneling or maisonette.
Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs. Symptoms of hepatitis includes fatigue, fever, yellowness, muscle and joint pain, dark urine, discoloration of feces, itch, nausea, and pain on the right stomach.
Viral infections of the liver that are classified as hepatitis include hepatitis A, B, C, D, and E. A different virus is responsible for each type of virally transmitted hepatitis. Hepatitis A is always an acute, short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Hepatitis C is usually acute but can be particularly dangerous in a pregnant woman.
Intervention for the patient with hepatitis. Monitor dietary intake and caloric count. Suggest several small feedings and offer largest meal at breakfast. Encourage mouth care before meals. Recommend eating in upright position and encourage intake of fruit, juices, carbonated beverages, and hard candy throughout the day. Consult with dietitian, nutritional support team to provide diet according to patient's needs, with fat and protein intake as tolerated. Monitor serum glucose as indicated.